You know, what I feel is that you come across every sort of a person in your life.
Yes.
Some people are a bit more arrogant. Some
Bit. Hello everyone, this is Dr. Salma with Let's Talk Aesthetics. Today I have an honorable, very senior doctor. If you're a doctor, every one of you already know about them. Professor Dr. Atif Kazmi. Welcome.
Thank you.
I'm so grateful that you are here, and I'm sure anybody who has gone through medicine, they know you and they are grateful to you and all the work that you have done. So for people who don't know, and I'm sure a lot of people do, but especially on the international scene, if people don't know, let's talk about a little bit. So you've been through many different medical schools and trainings and what have you. So tell us a little bit about yourself, the people who don't know.
First of all, thank you very much for inviting me here.
Yes.
It's a great pleasure to meet you. The main thing is that I graduated 45 years ago from Medical College.
Yes.
And 45 years is virtually more than half the life of a person.
That is true.
And I'm in dermatology. But if you really ask me my dermatological journey,
Yeah.
I am a born dermatologist.
There we go.
My father was
Yeah.
founder of dermatology in Pakistan.
Ah, you had it in your genes.
Yes, that's all that's it. And my father, he started dermatology way back in 1955. And he was the founder and father and late Professor Ghulam Shabir. And
Yes.
he was the one who founded the Department of Dermatology in Integrative Medical College. And then ultimately, I was there in KE, then I was in Hasnain Medical College in Ahmedabad, now in University of Lahore. All in all, my more than half of life has been spent in dermatology.
I say from the moment I think from you have all your life has been in dermatology
No,
in one form or another.
I was born.
The day, even before you were born.
Well, before I was. Absolutely.
Yes.
My two sons are dermatologists.
Wow.
One is
The
in
tradition is carrying on.
yeah.
Okay.
One is in UK, one is in Ireland. And I feel very blessed. I was the pioneer of lasers in Pakistan. In 1997, 98, I introduced the first diode hair removal laser.
Wow, everybody, that becomes a common name now.
Yeah,
Thanks you.
Yeah, so very kind. Yeah. So I started this in Pakistan. At that time, at that moment, people thought that maybe in Pakistan you would not be very successful in having or are in a very conservative society,
Right.
being Muslims. The female would not come
Yeah.
on the laser hair removal. But I tell you that when I started back then, I also had certain reservations that I spent so much money
Yeah.
and on that laser equipment. But I tell you that all the females coming to me with the hair all over the body, not on the face,
Oh.
the whole body, who were doing waxing, threading,
Right.
the procedure. So there were a huge number of females. And then I came to know that how much polycystic ovaries are
Right.
common in a female.
Yes.
Because I always ask them, those females, that you must go to the gynecologist and the gynecologist after investigation used to let us know that this lady is suffering from PCOS.
PCOS.
So ultimately, it was a good beginning with the lasers. As people started using lasers, no one knew at that time in the whole of Pakistan.
What is laser? Yes.
Then it started in Karachi, Islamabad, Lahore, Faisalabad, Peshawar, Quetta, everywhere.
Yes.
But now, obviously, then I came into aesthetics. And in aesthetics, I started doing the laser rejuvenation in rejuvenation.
Yes.
Then I had a laser for vitiligo. Yeah, for psoriasis.
Amazing.
So I had all the lasers at that time for various skin problems. So I think now the people, my students, my colleagues, they have benefited from what I have done for them.
Tremendously. Absolutely.
And I presented papers, research papers in all age in American Academy of Dermatology, British Association of Dermatology, then EADD, European Academy of Dermatology. And people were amazed to see.
Yes.
And in Pakistan,
We have that kind of
yeah,
technology work happening.
yes, and we have people to manage it.
Yes.
And God is very kind.
I mean, mashallah, you've been on quite a journey. I mean, you are so humble. And I mean, looking at you, I can't even, like, you're still, mashallah, in such good shape. You're doing so much amazing work. And it is always extremely good to see when we see Pakistan's name at the international level. When people see Pakistan and they equate it with knowledge, with power, with empowering other people. And you have students all over the globe, I believe. I mean, you have hundreds and hundreds of students that have gone through these 45 years. And thanks to you, I mean, we have lasers of common name in the household. People are aware of PCOs. So much, so we really, thanks to you, that we have it now available here. And people are talking about it at international levels because of what we're doing here, also in Pakistan.
You know, what I feel is that you come across every sort of a person in your life.
Yes.
Some people are a bit more arrogant, some people are more humble, more polite.
Right.
They're nice to talk to. Some people, they aren't very interested in being involved in conversations. So I personally feel, as a teacher, I'm still a teacher. So my students, anywhere in the world, I think, rightly said, globally, wherever I go to USA, UK, anywhere, so people come to know, if my students come to them here, they would always pounce upon me. Sir, please, we are coming to your hotel, bring your luggage, your wife, and everyone, come and stay with us.
Right.
We are very honored that you are here. It is because of you we have achieved these heights. So I feel that it is all due to God. And only blessed ones, certain blessed ones people, they are the ones who really are the ones who are the beacon of light for the future of the students, for the future of your country, where the country needs you, where people need you. So, I am still at this age working. I love teaching
Yes.
because whenever I go, I sit with the students, I talk to them, I teach them, I learn from them.
Right.
You always,
Isn't that amazing? I mean, like, that is such a strong trait. A lot of times people, when they're teaching or they feel like they know everything, they don't need to learn anything anymore. But mashallah, you look at you and like, after all of this journey, you feel you're still a student, you're learning. And of course, we need to be always open to it. But wow.
a doctor
Yeah.
is learning 24/7
You're right.
because
I believe you.
you
Yes.
just Google anything.
Yeah.
You go to the net, you will find everything new every minute, not every minute, every second.
And the information is changing
Yeah,
so fast.
because you have to be updated.
Yes.
In order to be updated, you must know everything. Because when you are interacting with your students, the students may ask you certain questions,
Right.
which we have.
You have to stay ahead of the game.
Yeah, that's what it is. So
Yeah.
I am the one who is always trying to be a best with all the latest
Which is
research, technology that is being done in the world.
I think that's the right thing to do.
Yeah.
We have to stay relevant, stay ahead of the game. So you are, giving all of this knowledge, but you're giving them in such a gracious way. You're approachable, humble, and I believe those are really amazing qualities.
Always.
And so what do you think about, PCOs you mentioned all those years ago? So PCO seems like a really big problem in Pakistan. What do you think about it? What is happening?
Initially, I was not very aware that
Yeah.
it would be such a problem. But now, in infertility,
Yes.
a Pakistani woman gets married,
Yeah.
she's not conceiving.
Right?
Let's say 3, 4 years, 5 years. The problem, marital problems start in the family.
Right?
Then when they get investigated, then it comes to the light that the girl, she's a PCO.
Right.
She got a lot of cystic ovaries.
Right.
And then in dermatology, hirsutism is a very important part.
Lots of hair on the face. Yes.
Acne,
Right.
asthma,
Yeah.
pigmentation,
Right.
hair loss.
All kind of issues.
All issues
Right.
are related to hormones.
Right.
So whenever a female comes to me with hirsutism, with acne, with melasma, with hair fall, I always first refer them to a gynecologist. I tell them, go to the gynecologist,
Get tested.
get yourself investigated.
Yes.
Once your investigations are there, I'll be there to help you out. And then we'll start the treatment. So the PCOS is not a problem in Pakistan, it is a global problem. I've been all over the world.
It
Every
is.
country, wherever I go, the females, the young girls, the married
Do
women,
you think it's on the rise, though?
I personally feel yes.
Yes.
Because the reason is the diet we are taking nowadays, artificial diet,
Yeah.
fast food, these city drinks, anxiety and stress.
Very high. Especially,
Then we are taking a lot of steroids.
yeah.
Oh, nowadays people are self-medication is on the rise. People are taking steroids by themselves over the counter. In Pakistan, it's not necessary to carry a prescription to get your medicine. You go to the pharmacy and tell them, I want this. They will give you. Whether it is a steroid, whether it is a life-threatening drug,
Medication.
they are not bothered. But then this is a problem that due to our habits, due to the changing environment, due to the culture that we are living in, the PCOS are.
Yeah, it is becoming more of a global issue. But
Yeah.
so, what would you suggest to people, young girls, anyone? I feel the infertility is on the rise in men as well in Pakistan.
Yeah.
So people, young people, like, what is some of the things that they should be doing to avoid the issues coming up if they don't have it yet?
So I personally feel that my advice to younger lot would be that you are there to live a longer life. You are there to become the pillars of education. You are take care of your health. Always be a step ahead before you get anything.
Yeah,
You should know.
prevention is always
Yeah,
better.
So you should be proactive. This is the proper word.
Yes.
And when you are proactive, you are able to know so many things about yourself. No infertility, that's a real. It's
Yeah.
not only why should we blame female.
Female only. That is
Then
a
the
stigma in
female company,
Pakistan, though. Yeah.
This is what it is.
Yes.
The male says no. When I ask me to get your semen analysis done, no, why should I get it done? I'm okay.
I'm fine.
Ask my wife. Ask
Yeah, right.
I only lady.
Yeah.
I only your spouse. You are equally responsible.
Absolutely.
Why only to blame your partner?
Yeah.
Get yourself investigated. So my advice to these people also, these couples who are trying to conceive, who have problems, both of them should be investigated
Absolutely.
thoroughly.
Yes.
And after investigation, then we should come to know that who is having the main problem, major problem, and then we resolve the problem. Whether it's a male or a female, and then only it can be done. Your ego should not be.
That is, ego normally doesn't serve anyone anyway. So be open. Open to possibility. If you're not, I mean, if one person is not to blame, it usually takes two.
Our men
find out.
are very egoistic in Pakistan.
Yeah.
Males
How do we change that? I mean, that's like, so that is what is going on right now. But how do we change it in our next generation?
Make their actually teaching, number one.
Yeah.
Social media, number two. Ultimately, inculcate in them that the God is the one who is the supreme. And you should have trust in God.
Ultimate power and control is in God's hands.
Is the God.
Yes.
And don't just blame your partner. Don't just blame for it. Like in Pakistan, every male
Yeah.
blames the partner.
Right.
You are responsible for this. You are responsible for this. No. I've been married for more than 40 years. I never blame my wife. This is a problem.
I'm sure you are a very happy marriage. That's the secret to a happy marriage. Make sure don't blame your wife.
So, me and my wife is sitting together, we discuss a problem, it's all gone.
Right.
Rather than
That's the way to do
I
it.
say, no,
Yeah.
you are responsible.
Right.
You have done it. You
That
are there. So, this is
doesn't
not the
solve
way.
anything.
Exactly. So now we should quit out of it.
Yes. It's about time.
Yeah, it is about
It's about
that.
time.
We are all educated people.
Yes.
Women are educated.
Women still feel very restricted. They
Yeah.
feel like they don't have the freedom, they cannot make choices, and they are pushed into different choices.
Yes.
Then they're not happy. And if half of your population is not happy, the country cannot progress either.
Absolutely. I agree.
So you are now in University of Lahore. And you're doing amazing work over there. I know you guys are working with a lot of nonprofits as well,
Yeah.
empowering people who don't necessarily have the means to, get educated. Could you tell us a little bit more about that?
Basically, University of Lahore and other universities who are basically involved into these programs, non-profit organizations, they are the ones who have volunteers to work. Now, University of Lahore, they have campus in Uganda,
Wow.
a campus coming up in Istanbul, Turkey,
Yeah.
a campus coming up in Bishkek,
Wow.
and one in Azerbaijan. So this is all for education purposes. And having people there and asking them to be volunteers in every type of program and helping them, assisting them,
Yes.
being a part of them, and showing that we have full confidence in our team. Then you get results.
Absolutely. And I know recently you guys were working with an organization called Noor.
Yes, no.
And you guys just recently donated a whole physical therapy wing to them, which is amazing. And they're serving so many people, providing them food, education, and then hospital services.
Absolutely.
So that is, I really love that project.
Basically, I feel that it is people who are at the helm of affairs,
Yeah.
who are supposed
In it
to
every day.
in it.
Yeah.
So once they are sincere, once they are very sympathetic, once they are committed, dedicated, I think nothing can change that. Then the ship can go on and on. But once the people who are not interested and they feel that they just have to go for a TV talk show and come back and no results, then you are nowhere.
You can't solve anything.
Exactly.
I think we have too much of that in Pakistan. We need to change that.
We have changed this culture.
Yes. It's like so I am usually in California. And then or in UK sometimes. So then the whenever you talk about Pakistan, there's always this negative stigma. It's like you're from Pakistan, it's like people feel like either it's not a safe country or women have no choice, no power, no freedom. So like people are always asking, are you sure? Or are you it's like either they don't believe I was born here, or they don't believe like I wanna be here. I wanna work with people here. So I'm so happy to see University of Lahore is like spreading also, but all the work that you have done overseas and your people you're spreading. So I think education is so powerful. So we show people a different perspective. We show people a different face of Pakistan too. It's not just what the media may want to show overseas. So what now as you're going? Do you have any projects coming up? And what is next for you? Like, what is the next thing coming up?
Basically, we are now into aesthetics.
Yes, tell me about aesthetics in Pakistan. That is such a problematic concept.
The reason is in Pakistan, I personally feel factory is very rampant.
Yes.
You don't find qualified people doing all these things. Those persons who are non-doctors, who are non-qualified, and who want that they should ultimately become rich overnight, they are turning towards these aesthetic procedures and cosmetics.
So if you are a regular person looking for, as a patient, looking for care, what should somebody be looking for? Because I think it's so much information out there. It is hard for a regular person to figure out who should they go to, because it's people follow social media trends. And if somebody's showing up with hundreds of thousands of views on social media, they feel like maybe this is the place to go. And they get kind of duped by that. So what would you advise a regular general public?
Question.
Yeah.
I would recommend that nowadays it is a social media war that is going on. And we have everything on the Google, the net, and everything, all the social media is available. The best thing is, you would like to visit, let's say, a gastroenterologist, you would like to visit a gynecologist or a dermatologist or a plastic surgeon, go to the net, Google,
Yes.
try to find a qualified doctor because in a medical college.
Ah,
That is very important.
yes.
In medical colleges and medical universities, there are qualified people who are only there because they have been selected by the Public Service Commission, by EMDC recognized. So they are there to help you out. So you don't need to get your
From
from
social
your
media.
neighbors, from your social media. Your
Right.
oh, come on, forget her.
Yeah.
Go to the doctor, forget him. Go to this place. No, you just have to vouch
Yes.
for the best doctors and the medical college teacher. Because in medical colleges, all the facilities are available.
Yes.
Wherever you go there, I am a teacher now. I go to, I do my study in UK as well. I have a house in London.
Right.
I go there, I'll just come back 1 week before.
Okay.
In London.
Yes.
My son is in Kent.
Okay.
He's a dermatologist.
He's a dermatologist there.
Yeah, yeah.
Yes.
So I meet so many people
Right.
in England when I go there.
Yeah.
Pakistani, Indian, Sri Lanka.
Not Pakistanis are in
Yeah, yeah.
England,
They are-
London. Oh,
London.
yeah. We have quite a lot of big community there.
When I meet them, it's a little to know that those people who are there, they know that who is the best in their field and they really prefer. In England, it is something different because NHS is one, then GPs are two,
Right.
then the specialist is three.
Yes.
It all depends upon the amount of money that is spent.
Right. Yeah.
we-
Unfortunately, that is true for everyone.
Yeah, yeah.
But I think it still is. It's always good to have options.
Yeah, yeah, good.
Explore the options. Find out what is good, what's
Yeah,
not.
this is what.
And what is basically now? So you're traveling. You are with education. Like, what is your passion project? Like, you are like most like. What do you like? You've been working all these years and imparting knowledge, and there's many different roles. So from now, at the time that you are in life now, I mean, like you can pick and choose what you want to do. But what is one passion that you feel like you haven't accomplished and you want to accomplish it?
My passion would be at this at this stage of my life is to teach people in Pakistan to be good human beings first.
Oh my gosh, so true.
Very important.
Yeah.
I teach my subject. I
Yeah.
know my subject. I'm
Right.
the best in my subject, dermatology, aesthetics. But I would fail to deliver my responsibilities if I do not make you a good human being. I can
Absolutely.
teach you dermatology.
Yeah.
But if you're not a good human being,
It's a waste.
then this. So this is my passion. Because when we see students in Pakistan, I tell you, you see the students here. We should be very optimistic
Yeah.
about the future.
Right.
Brilliant students, but the way they should be taught,
Yeah.
the way the training should be done for them. That's very important.
Absolutely.
So that they can
I
become
totally
good
agree.
human beings.
Yes.
They can become good mothers and fathers. They can become good parents.
Yes.
They can
They have to lead a generation.
yeah, the upbringing of the children should be like this. So once you're
No, that is so important work. Your students, the people who are young right now.
yeah,
So if they don't develop these strong personal human traits, if they cannot connect to their patients, they
Yeah.
cannot connect to their people, if they don't really become good human beings, like you're saying, it's like a whole generation in their hands. The future of the country is in their hands.
it's sure.
So important. So yes, stay humble, stay grounded, become a good human being first before anything else. And that is amazing.
This is what is my passion. Once, because these students, these youngsters, they would go abroad, they would represent your country.
I'm full.
They would represent your national flag.
Yeah.
They would say, I'm from Pakistan. And then I'm the best among the best who's here. And we just me around.
Yeah.
So when these students will go, they will bring a good name for your country, good name for themselves. And people would appreciate, like as you go to England, you come back, when people know that, mashallah, you are the best in your field.
Right.
So they would appreciate. And I tell you, as you already know, you are there, I've been all over the world. People there, They value broad people. They value only for those people who are the best in their field.
Yeah, it's true.
So once you are a good human being,
But you have to also remember, you may be best in your field, but if you're not a humble person,
yeah,
that doesn't work.
no,
For me, I think
yeah,
it's
I
like
agree.
you cannot connect with people.
I agree.
You become too pompous, too proud, too much ego, and that doesn't serve anyone. We need to be able to serve others.
What you are saying is absolutely correct. Something is genetic as well. You
Okay.
cannot change the genes.
I don't know. That maybe
Yeah, there are-
more in Pakistani
You can
genes,
modify. You can modify them.
Yeah.
But then ultimately, it is very difficult to change the DNA.
Yeah.
The DNA remains there.
Right.
The deoxyribonucleic acid, the genetic. But I ultimately feel whatever you have said, that being humble, being polite, being down to earth,
Yeah.
being nice to people, I think this is the
That's the
hallmark
top.
of a good human being.
Absolutely. Very well said. Thank you so much. We will take you with that. It was absolutely phenomenal. Thank you for all the amazing work you're doing.
My friend.
And such a pleasure. Thank you.